Hello guys, good evening all. Hope you all are well and doing great. This is Dr. Prashant Agrawal, your faculty of psychiatry. Today we are going to discuss the most authentic questions of psychiatry which were asked in your last January, means January 24 Fmge exam. So without wasting much time, let us begin our session. So this is the first question which I got from many of the students. This question says, a 25-year-old female has had manic and depressive episodes and she needs treatment. Definitely, lady is having bipolar affective disorder. This lady in the question is having bipolar affective disorder and she needs treatment for her condition. Which of the following medication causes least weight gain? So this is the question originally from psychopharmacology. And if you remember, I have told you in our live classes that there are three medications, three antipsychotic drugs which do not cause any kind of weight gain. Means those drugs are known as weight neutral antipsychotic drugs. So let's see which are those three drugs. If you remember, I have told you when patient develops schizophrenia, if any patient develops schizophrenia, we start antipsychotic medication, or if any patient develops bipolar affective disorder, then also drug of choice, first drug of choice is antipsychotic medication. Which antipsychotic medication? We use olanzapine followed by risperidone followed by lithium. So this is the sequence. Means antipsychotic drugs, all second generation antipsychotic drugs, they have mood stabilizing property. So we can use antipsychotic drugs in bipolar affective disorder. Clear? But we all know that antipsychotic drugs produces metabolic syndrome X. It causes weight gain, it causes hyperprolactinemia, it causes hyperlipidemia, it causes diabetes mellitus, it produces diabetes mellitus. So there are various metabolic side effects which we see with these antipsychotic drugs, but there are three weight neutral antipsychotic drugs which contains my name in it. So let's see which are those drugs. First is aripiprazole. Next is ziprasidone. Third, so now at present we have four weight neutral antipsychotic drugs. Recently there is an introduction of this brexpiprazole in our basket, in antipsychotic basket, and last is so basically these four are weight neutral antipsychotic drugs: aripiprazole, ziprasidone, brexpiprazole and lurasidone. So if you see, first three drugs contains first three letters of my name, Prashant. P-R-A, P-R-A, P-R-A. In last one, they have forgotten to put P. So they have kept R-A in this medicine. So we all know Z is the last letter of our ABCD alphabet. It starts from A and finishes at Z. We know A to Z. So Z is the last letter. Last letter. So ziprasidone, among these four, ziprasidone is the antipsychotic drug which produces least weight gain. It is the drug which produces least weight gain. And we can also remember Z means जरा सा. इससे जरा सा भी वेट गेन नहीं होता है. इससे जरा सा भी वेट गेन नहीं होता है. So you need to remember first three letters of my name, P-R-A, P-R-A, P-R-A. And we could also remember the names of these drugs by mnemonic. These drugs, they restrict appetite. These drugs actually restricts appetite in the patient. So that is why they do not produce weight gain. So our answer here is ziprasidone, which produces least weight gain. Clear? So this is the table from Maudsley prescription guidelines which we follow. And you see this ziprasidone is written in the last. So ziprasidone produces least weight gain and maximum weight gain is produced by clozapine. This is the table. This is the table. So clozapine produces maximum weight gain and ziprasidone produces no or zero weight gain. Z for zero. So zero weight gain is seen with ziprasidone. Clear? So hope this was one of the very easy question for you. Okay, next MCQ. This question is slightly tricky. Let's look at the question. A 59-year-old male patient believes that his thoughts and feelings are being controlled by some ghost or external agency. Means some ghost, some external agency like alien is controlling thoughts and feelings of the patient. This is known as what? Is this delusion of persecution? Is this delusion of infidelity? Is this nihilistic delusion or this is delusion of influence? What it is? Tell me. Come on. Hurry up. This is what? What is delusion of persecution? If you remember. If I think that two people, they are planning against me. My family members, they want to kill me by giving poison in my food. Police is trying to catch me, is trying to arrest me. That is delusion of persecution. When people are planning, want to do some harm to me, that is delusion of persecution. What is delusion of infidelity? Delusion of infidelity is also known as Othello syndrome. My wife is doing hello with some other guy. That is Othello syndrome. So delusion of infidelity when partner is not loyal, not faithful to the person. What is nihilistic delusion? Delusion of nihilism. It is seen in old patients, those who are suffering from severe depression. Patient starts believing that There is no head on their body. Their intestines are all rotten. There is no one around them. They are dead. Their family members are all dead. They can't eat food because they do not have head on their body. So how they eat? Because they do not have head. When they see mirror, they do not see their head on their body. This is nihilistic delusion or Cotard syndrome, which we see in depression, severe depression, especially in old age. So we are left with only one delusion, that is delusion of influence. It is the part of delusion of persecution. This is little tricky MCQ for you guys. Delusion of influence. When somebody, ghost, alien, external agency influences my thoughts, my feelings, means my feelings, my thoughts are being controlled by some external agency, that is somebody else is influencing my feelings. So that is delusion of influence. So this is the correct answer, delusion of influence. And it is given in Fish textbook of psychopathology. This is, this is the book which we read as a postgraduate students, as a clinical psychiatrist. This is not for you guys, even not for those who are preparing for PG entrance exam. This is a high level thing. So here it is given, delusion of influence. Delusion of influence are a logical result of experience of passivity. Passivity means whatever I am feeling, whatever I am thinking, it is being controlled by some external agency. So somebody else is influencing my feelings, my thoughts. Clear? So the correct answer to this question is option number D, that is delusion of influence. So this was one of the tricky question for you, but most of you, I feel, have marked this question correctly. Okay, let's see another question. Again, it is a very simple question. A 6-year-old child is having repeated tapping movement. He is having lack of attentiveness and cannot sit at one place. Means child is very, very active, overactive, moving here and there, tapping continuously, moving here and there. Inattentive means there is a problem in focusing attention, and child is very hyperactive, overactive. So this is a case of ADHD. We have discussed in our live face-to-face classes as well as online classes. This is a case of ADHD. Child is having problem in focusing attention, and we all know what is the drug of choice for ADHD. It is methylphenidate. It is methylphenidate. Clear? So the correct answer to this question is methylphenidate. So methylphenidate is the stimulant drug which we give in ADHD. In the cases of ADHD, there is second drug of choice is atomoxetine. This is atomoxetine is what? It is noradrenaline reuptake inhibitor. This is non-stimulant drug. This is non-stimulant drug that is used in the treatment of ADHD. Non-stimulant. Methylphenidate is an stimulant. Methylphenidate is an stimulant. Atomoxetine is non-stimulant. Clear? So second drug of choice, atomoxetine. There is no use of giving risperidone, no use of giving guanfacine in ADHD. So correct answer is option number B. Okay, now let's see next another question. Again, tell me answer to this question. I have told you 100 times in our classes. Whenever you see these lines in your MCQ, answer always will be this. Okay, now let's see. A man who is multiple substance user. A man who is a multiple substance user presents with sweating, tachycardia means features of anxiety. These are features of anxiety. Plus, this man also sees a red light on hearing radio music, means sounds are producing visual hallucinations. Sounds are producing visual hallucinations. So seeing red lights when man hears radio music. So this is what? Synesthesia. This is what? Synesthesia or reflex hallucination. This is what? Reflex hallucination. We have discussed. In reflex hallucination, stimuli in one sensory modality produces hallucination in different sensory modality. So whenever I hear radio music, I would see a lady standing in front of me and wearing red color sari, or I will see a red ghost standing in front of me, or I see a red light in front of me whenever I hear radio music. This is what? Synesthesia. Second symptom, second example, whenever I see my wife, or whenever I see blue color in front of me, I would hear voice of a ghost talking with me. So visual stimulus is producing auditory hallucination. Here in this question, auditory stimulus is producing visual hallucination. So synesthesia means hallucination is seen with what? It is seen with hallucinogen, and most potent hallucinogen known to man is what? LSD. Lysergic acid diethylamide is the hallucinogen, and this is a case of what? Bad trips. Why? Because after consuming LSD, person is feeling anxiety, person is feeling tachycardia, there is a sweating, and radio music is perceived as red light. Radio music is perceived as a red light. So that is not a good experience for a person. So that is seen with hallucinogen, and hallucinogen among these four is LSD. So the correct answer here is LSD. Clear? It is not heroin. We already know which are the features of heroin intoxication. There is a pinpoint pupils, there is a dryness of skin, there is constipation, there is bradycardia, there is no tachycardia, there is bradycardia, there is a hypotension, and dry skin, not sweating, dry skin. Cannabis, in cannabis there is a redness of eyes, not red lights. Red light is seen. There is redness of eyes, increased appetite, thirst, increase in thirst, and person develops acute confusion. Acute confusion. Clear? Third, cocaine. In cocaine intoxication, we see manic-like symptoms like over-talkativeness, elevated mood, increased happiness. There is a sweating, there is a hypertension, there is a tachypnea, and along with those symptoms, there is delusion of persecution as well as tactile hallucination. Those symptoms are typically seen with cocaine intoxication, tactile hallucination and delusion of persecution. So none of these symptoms are there in this question. So the answer to this question is option number D, that is LSD. That is LSD. Clear? Now next MCQ. A patient feels that some alien or external agency, means ghost, is inserting thoughts in his mind. What is the diagnosis? So we have discussed in first rank symptoms of schizophrenia that there are three thought phenomena: thought insertion, thought withdrawal, and thought broadcasting. What is thought withdrawal? Somebody is removing, somebody is stealing thoughts from my mind. Whenever I start thinking, suddenly I become blank. Why? Because the upcoming thoughts have been stolen, removed from my mind by some external agency. So that is thought withdrawal. Thought insertion, when some external agency is inserting thoughts in my mind, putting thoughts in my mind, means I think only those things which external agency, black magician, ghost, alien wants me to think. So whatever I am thinking, they are not my thoughts. These thoughts are inserted in my mind by some external agency. That is thought insertion, also known as thought alienation. Thought insertion by some alien, thought alienation. What is Othello syndrome? Othello syndrome is a type of delusion we have discussed just now. Othello with some other guy, that is delusion of infidelity. What is thought echo? Thought echo is a type of hallucination. It is a type of hallucination. In thought echo, patient hears own thoughts loudly, as if somebody is speaking their thoughts loudly. Suppose if I am thinking that I have to take the class of psychiatry at 7 p.m. As soon as I finish this thought, I would hear the same thought loudly, as if somebody is speaking. I have to take psychiatry class at 7 p.m. I am hearing my own thoughts loudly. That is thought echo. So the answer to this question is thought alienation. It is thought alienation. Clear? So I hope you all are getting my point clearly. Next MCQ. Again, this is a slightly tricky question for you guys, I would say. A 40-year-old male presented to emergency with chest pain and no medical cause found. Patient presented to casualty, but everything is within normal limit. There is no hypertension, ECG is normal, everything is normal. Patient told 10 days back he was robbed on gunpoint in his house. Means some robbery has happened at his home on gunpoint. So suppose if you are alone in your home, and somebody has robbed you on gunpoint, how would you feel? You feel terrified. Means that will be a bad, worst experience of your life, that somebody has robbed you on gunpoint. That is a very terrifying experience, near death kind of experience, that if you could have died, killed by someone, you could have been killed by someone. So that was very terrifying experience. So when doctor wanted to discharge him, patient refused to go back to his home. His family members told his pre-morbid condition before incident was totally normal. Means before this incident of robbery, patient was totally normal. There is no any pre-morbid anxiety, there is no pre-morbid, means before incident there is no avoidant behavior, there is no delusion, there is no hallucination, there is nothing wrong with the person. He is non-drinker, nothing is mentioned about alcohol or any other kind of thing here in this question. So first option, what is the likely diagnosis? The examiner is asking what is the likely diagnosis. Delirium. Is it delirium? This is not delirium. Why? There is no confusion in this patient. There is no disorientation to time, place and person. So this is not delirium. So we have ruled out delirium. Why not schizophrenia? First of all, before robbery, patient is not having any kind of symptoms, positive as well as negative symptoms of schizophrenia. None of the symptoms are mentioned here by the examiner. Second, incident has happened 10 days ago. 10 days ago, and criteria for diagnosing schizophrenia is if the symptoms lasts for more than 1 month. So this is not schizophrenia. Patient presented to casualty with chest pain. Patient has not presented to casualty with auditory hallucinations, fearfulness, delusion of persecution or any kind of negative symptoms, disorganized behavior. Nothing is there. So this is not schizophrenia. Anxious avoidant personality disorder. It is already written here that pre-morbid condition means before incident, the personality, the behavior of the patient is totally within normal limit. There is no avoidant, no anxiety, nothing is there. So definitely it is not anxious avoidant personality disorder. So the correct answer to this question is acute stress reaction. And we all know, for making the diagnosis of acute stress reaction, it is a part of PTSD. We require symptoms for less than 4 weeks. Less than 4 weeks acute stress reaction. It is self-limiting condition. It develops after some stressful or threatening life event. So robbery is a kind of threatening life incident. Person could have died, killed by the robber, but somehow he survived. He is alive. So but that was a very terrifying experience for him. So that is why there is a stress. So that is why patient might be having that flashbacks about the incident. Patient is very fearful, afraid about that robbery incident, and that is why he doesn't want to go back to his home, because he is feeling as if he goes back to home, there might be robbery incident again. If it happens again, what will he do? If the robbery happens again, what will he do? So that is why he is very fearful. So that is why he doesn't want to go back to his home. So the correct answer to this question is option number C, acute stress reaction. So these are the 6 questions which I have got from students as well as other faculty members of psychiatry. So hope everything is clear now, and I hope you all will pass this exam, and I want to wish you all the best for the results. Even if you have made questions wrong, don't be afraid, don't be panic, because it happens with all of us. Even toppers will never toppers would not get 100%, 100 out of 100. So even toppers, they make mistakes, and we just want to pass the exam. We just want to clear the exam with 50% marks only. We do not want 70%, we do not want 80%, we just want 50% questions correct. And I know that all of you will pass the exam with flying colors. So all the best.